Okay, guys, we are going to be live on Facebook right now. This session, guys, will not be a long session. This session will be a short session. But before I start, let me double check this. Let me, guys, check if you are on live on Facebook or not. Please, guys, if I'm live on Facebook, please let me know. If you can hear me clearly, please, guys, let me know. Okay, guys, can you hear me? Please, guys, if you are in Facebook, please, guys, let me know. Okay, guys, I believe it's a good time to start right now, and I hope everyone of you guys doing great. Let me check the Facebook right now. Let me also share this my PowerPoint. Please, guys, if you can see my PowerPoints on the Facebook, please let me know. Okay, guys, for a start, I would love to check on every one of you, and I hope every one of you guys in good health and you're doing great. Guys, again, I'm not quite sure if we're live on Facebook or not, because I can't see nothing from my side here. I'm trying to look, but I cannot find any. But let me. Okay, now I can see that I'm already on Facebook Live. Now I can see, but I cannot see all the comments because I just see it right now. Give me 1 second, please, guys. Facebook. Okay, that's great, guys. I can see now on the Facebook. Dr. Didi Damish say hi, Dr. Bido. Hi, Dr. Didi Damish. Hi, Dr. Fatima. Hi, Dr. Harisha. How you going? Hi, Dr. Simran. Thanks very much for letting me know. I don't see all the comments as I said before, but let me try to look at them again. Hi, Dr. Shashank. Guys, am I audible? Because Dr. Simran says I'm not audible. And also Dr. Fatima said I'm not audible. But Dr. Shashank say hi, Dr. Bido. Dr. Harisha say hi, hello, Dr. Bido. And Dr. Didi Damish say audible. So I'm not quite sure if I'm audible or not. Yes, visible. Hello, Dr. Bido. Hi, Doctor. Yes, audible. Dr. Shiva, hi, Dr. Bido. Audible now. Audible. Hello, Dr. Audible. Okay, that's good. Okay, guys. So as long as it's audible, as long as. Thank you, Dr. Shiva, very much. Okay, guys. Today, we're not going to be an orientation session for our course, but this is an orientation session for EDC exam itself. Last time, I discussed about the reason that makes some candidates pass the exam or the secrets and other people why there are some other candidates cannot pass the exam. So I wish if you guys took the last session seriously because it's very important to understand why some people they pass the exam and then you can be one of them and then you also can avoid to not stuck in the exam because easily people can stuck in exam, but I don't mean for the people they couldn't pass last time they are not good candidates at all because I have seen lots of beautiful, smart and hard worker candidates, hard working candidates and they couldn't pass, and then they pass on this attempt or the next attempt. So that's why I never gave up on them at all. Okay, Dr. Fatima, we can do this today. No problem at all, as long as everyone happy about this. Guys, would you like me to discuss the Facebook questions? So I will go through my PowerPoint, Dr. Fatima, for today quickly, and then after this, I would love to hear from you. By the way, guys, I just have arrived today to Australia. Definitely, you know, the trip's always a long trip to come back to Australia, especially if you are in Europe or outside the continents here, Australia. So I just arrived this morning. And also, I'm somehow, guys, again, my voice, again, sorry, guys, about this, but I'm on some medicine, and this medicine makes me a little bit drowsy. And this is for the last 2 or 3 weeks. I'm somehow drowsy, and then, but getting better in my medical condition right now. Not bad, comparing myself for the last 2 weeks. Okay, so please, guys, don't mind my voice today as well. I think I'm getting better, and then within maybe a few days, I will be back again to normal, and then I can get into my life normal way. Okay, no problem. Thank you very much, Dr. Ashwani, for saying this, and no problem, Dr. Jilan. Thanks very much, and Dr. Shiva and everyone, guys. Thanks very much for this. Okay, if I get this one on here, what if I get it from Facebook itself? And then the chat from the side. Sorry, guys. Yes, I'm trying to get the chat on Facebook because I cannot see the all comments. I want to see all comments. That's very weird why I cannot see all the comments, but that's okay. I can use my phone to see all the comments. Okay, guys. So let's go through the PowerPoints first. By the way, let me just tell you what's happening today and what's happening for the next few days. So today, as you see right now, we're going to discuss about what we call it as smart ways to plan your preparation for the examinations. So this is what we're going to today, plus I will be answering the Facebook questions and also give you some steps what we're going to do from next week, which is Monday, because Monday is the start as the official time of our course. Like what we did in our course before, it was just we call it as warming up stage, wasn't actually the course, was some toward TG and the basics that you must know because later on we going to repeat even TG again because I know not everyone of you has completed the TG, especially the new TG as well. And that's what I promised that we go into discuss the topics for new TG in details in simplified way and our expectation for the exam, what sort of topics may come in exam and which points in every topic is every topic important for the exam perspective. Guys, am I audible to everyone? And am I clear about what I'm saying right now? Okay, so tomorrow, I believe we suppose to have mock tomorrow, but we know we're not going to have a mock tomorrow, guys, because um, we're gonna keep it on Sunday. So on Sunday, you will be able, because I got messages from the candidates that they said they need some more time to revise TG, because the mock will not be only for the third TG task, but will be for the whole TG. So the mock will be on Sunday. And on Saturday, we're going to have a session. And this session will be one of the topics of new TG task. You can actually choose which one. I'm going to post it right now. Guys, remember how many points we discussed in the new TG? We said there are few points that are related to the new TG. Do you guys remember them? Thank you, Dr. Shashank. You're very smart. Eight, yes, 8 points. I love the candidates when they are focusing and concentrating, like Dr. Shashank. I was worried that no one of you guys memorized this, but you made me happy now, Dr. Shashank. Yes, please, Dr. Walija. Yes, well, guys, I really guys like you very much. And Dr. Shiva and Dr. Saifa. Yes, it's 8 points. So right now, let me do it right now, guys, on our Facebook. Give me a second, please. So please tell me which one actually new TG task. Sorry, new TG topics and answers. Topics and questions. Okay. Okay. Before. Okay, guys, I posted it right now on our part one Facebook group. Please, Adam, if you can't give the link to the champions to choose a date. Okay, guys, so I posted there. You please need to tell me which one actually you want me to discuss on Saturday. Now, to repeat this again, the mock exam will be on Sunday. And UTG topics, and then the topics that I believe will be more important for this year, the new topics. Plus, in every topic, we're going to focus on important points that can be a question in ADC exam. Now, If you are new into part one and there's a first time ever take the exam, or you did the exam before at any time, either the last 10 years, or the last 5 years, or the last 2 years, or the last exam. So this PowerPoint is actually for you. Understanding, as you see right now, the first instance is understanding the exam system. And then you need to perceive the new exam format. And then how smartly you can plan for your exam preparation. And then we're going to give you some mock exams. So smart ways to plan your preparation for the examinations. How a dream comes true. A question here, guys, to you is how big is your dream to pass ADC exam? This is always a question I love to ask the champions. Why I'm asking my champions or all other champions, they take in the exam this question? Because based on this, I can tell two things, or I can know two things. The first thing is how much you can sacrifice for your dream. That's the first question. Second question, how much you will fight to achieve your dream. The first question actually gives me some ideas about who you are in sense of how much you will study. The second question gives me an idea about how strong you are. How strong you are means, as I discussed in the last session, personality is a matter. Who you are, how strong you are. Because when you are strong means once you get closer to the exam, you will be yourself. You can manage your stress, and then definitely you'll be able to pass the exam. And also, second question gives me an idea about the candidate. They will run away from the fight, and the people they will still fighting and never give up, regardless whatever happening. That's why I always ask this question. So I wish to be the champion who doesn't really run away in the battle, and also they can sacrifice most of the things during this journey to achieve their dream. So I wish that your dream is really big. And dream is just a dream. Dream versus goals, or dreams versus goals. Dream, it's more into wish. Mostly a wish, something you dream about it. But goals, it's actually a wish plus real steps toward your success. So definitely we need to turn our dream to come to be true or to come true. And this is comes with not just a wish and hard work. As you see right now, a dream without a good plan is just a wish. We need to turn this dream to be a goal. So now let's talk about the plan as well and what things can make you actually achieve your dream. I call it as factors of success. Please, guys, look at these factors of success very closely because without these factors of success, will be a little bit hard to achieve your dream. As you see, as I always say, and I mentioned this is 100 times stress management. You need really, guys, to manage your stress. Everyone is different in this part. We are not the same. If you ask about my experience in this life and how do I manage my stress if I get any, I think based on my experience in this life and what I have faced in it since I was child until this moment, it's not easy to get stressed. It's not easy at all. I may get stressed, which is, I would say, rarely I can get stressed. But apart from stress, I got some upsetness. I feel upset or angry. When I see things not going right, I feel upset and angry. But as a stress, I learned one thing in this life. There is nothing in this life should stress me up at all. Whatever it is. Nothing, everything, guys, look, guys, this is me. And this is why I don't get stressed as stressed. For me, everything in this life equal to zero. There is nothing meaning that much to stress you. So everything is meaningless to stress you. Because I learned even if you want to keep something, let's say you love your mother and then your mother is sick. Let's say if this is my mother, I may not feel stressed, but I may feel not happy, like upset. Why? Because if I feel stressed for my mother's situation, I will not be able to help her. So internally, now I learned that the sickness of my mother is zero. It shouldn't stress me up, but I should feel not happy that I can help my mother. Look, guys, again, this is my experience. So anything in my life, as I said, it's equal to zero for me. I can lose it any time. I can gain it. It's not a matter because even our health, even ourselves, at this stage, it can be ended in a second. I'm breathing right now. Maybe after a second, 1 second, I can breathe. Why should I stress myself then? Why should I be stressed about anything? But as I said, I'm not feeling stressed about anything, but I feel not happy or angry or upset. That makes me to do better as long as I'm alive. So everyone is different in the stress management part. Some of you, they may get very much stressed, but I wish if you can manage your stress with lots of techniques. I have heard lots of people, they're talking about stress management, the way they do yoga. And then some of them, they take medicine, which I don't recommend. Some of them, they see GP. If it's really, really, really cannot be controlled by yourself. I have heard some people, they drink water to feel better. But I believe the best way is to believe in yourself and agree that there is nothing in this life should stress you up. I'm telling you my experience in the life. I hope you take it this way. Time management is very important, and this is will be sorted out with our daily plan. Our daily plan, we give it to you throughout the course. And also, if you guys can, before we used to tell the candidates to study up to 10 hours, yes. But these days with Bedo bites, cakes, and the diamonds, I believe you only need to study an average 4 hours, 3 to 4 hours. So if you can afford 3 to 4 hours being having your family, you work, you're busy and tired, that will be great as well. Motivation and dedication, this or these are the most important two things. Two factors of success, you must have them in you. Why motivation is important? Exactly like a car. A car without petrol or power, could be any sort of power, it cannot be driven exactly like you. You are like a car, like a vehicle. You really need the power inside you to keep moving. And your petrol to keep moving is your motivation. The best example of motivation always I tell the candidates about is look at your family at this stage, everyone around you, how they look at you at this stage. They want you to be the best person ever, and they helping you. Every time when you see yourself you demotivated, you have a long task, like a lengthy task, and then you cannot start this task for any reason, you feel bored or tired, or you feel lazy, you want to sleep, or you want to run to watch movies, tell yourself, hello, I cannot be this person. I have a family waiting for me. I need to see myself as the best dentist ever in this life. And this is only going to happen when I finish my dream. When I get my dream in true. And this is gonna happen with hard and smart work. Dedication. You really must be dedicated. You should. I always tell the candidates, you should breathe, drink, eat, think, sleep, ADC to achieve your dream. When you breathe right now, think about the questions and answers. When you drink, think about question answers. When you eat, when you think, when you talk to your friend, before you sleep, even when you dream. I want to dream about your dreams about ADC. By this way, your life will be only for this reason. And believe me, this is the only time you will be passing the exam. You will be passing the exam. Self-confidence and to believe in yourself. Tell you something. I look, you have now two types of people right now. Sorry guys again about my voice. And sorry if I have some pauses in between, guys. Am I too fast or too slow? Which one of these? So guys, again, because I'm a little bit drowsy, sorry for the medicine I'm on, which I cannot stop it these days, but also I cannot stop being here between you. Let me check your comments. So if I am slow, I will speed up. If I am fast, I will slow down. Thank you, Dr. Saifa, for saying it's good. So it's good, right? Dr. Fatima, it's perfectly fine. Okay, thank you for your reassurance, Dr. Fatima. Dr. Ashwani, all good. Dr. Bido, all good. Dr. Jaylan, say it's okay. Okay, guys, I'm happy right now as long as you find it is good, okay? No problem. Okay, guys, self-confidence and believe in yourself. Make it short. I believe in you more than you believe in yourself. Is that true? Yes. I cannot say this is for everyone, but almost everyone. How is this and why? You are now in this, wherever you are today, you are two different types of candidates. Either totally new champions, they doing the exam for the first time, or a candidate or a champion who couldn't pass the exam at any stage, at any time. I still believe in both of you, and you should believe in yourself too. From where this confidence coming from? How did I build up this confidence? I tell you, in the last 16 years of teaching, I have seen different types teaching ADC, guys, by the way. I think 14, 16, I cannot count. It's from 2011. I don't know, 14, 16. Even I know ADC from 2000. I know ADC from 2007, but I started teach 2011. Anyway, since that time, I have seen different types of candidates. Some candidates, they are perfect in everything. Personality, experience as dentist, knowledge, smart, and everything. And then I have seen some candidates, I would say they are competent, just competent. Maybe they are smart, but not having that much strong personality. And then I've seen candidates, believe me, guys, there's not against anyone, but that's true. I have seen candidates, they not competent at all to pass exam. Not competent. Why? Maybe they have weak personalities, not leader personalities, because dentists should be leader. They cannot manage their stress, they cannot manage their time. Knowledge wise, not very good, because they may be, for any reason, they smart, but not ready to pass the exam. In academy, when we see these three types, we can say this perfect person should pass the exam, the competent should pass the exam, and then the third candidates, they're not really competent at this stage, and then we may say the academy people, when they talk to me, they say, but this, because guys, we follow up on you. Say, but these candidates really, they don't study well, they always under stress, they always confused, we're really worried about them. But I keep telling them, based on my experience, every one of these going to pass. And I still believe in every one of them. Believe me, guys, even the perfect people, I have seen some of them, they don't pass from the first attempt. Yes, it happens. Perfect, and they couldn't pass first attempt. Yes. The competent people, they may not pass from the first attempt. These people, they may not pass first attempt. However, the perfect people can pass from the first attempt. The competent can pass from the first attempt. Even the third group of people can pass from first attempt if they fix themselves before the exam. Now, the three group of people, sorry, the three groups of people, regardless who they are, I have seen them pass the exam, believe me. That's why I learned through all my life, never gave up on any one of you guys. And no one of you going to fail unless you stop trying and stop doing good job. Once you give up, that's the only time you're going to fail. As long as you try, you never fail. And everyone going to pass the exam as long as you try. Opportunity cost. Do you know, guys, what does it mean by the opportunity cost? It is a cost that you pay or sacrifice today to get something better in the future. What does it mean? Cost that you pay. For example, if you work 7 days in a clinic today, you get every day $100. which is end up with $700 per week. I'm just giving an example. If you reduce your days to study, because you want to get something better in the future, and instead of 7 days, you only work 4 days, means you lost $300 per week, and that's your cost right now. And this cost, you actually sacrifice this cost, or you pay this cost to pass the exam, and instead you get $100 per day, you're gonna get $500 per day. So now you sacrificed the $100 per each day to get 500 once you pass the exam. That is called opportunity cost. In this life, you really need to pay the opportunity cost to get better. Otherwise, if you're not going to take the opportunity cost, you all your life will only get the $100 per day, but not the $500. I hope, guys, it's clear now. Point. Family issues. Family issues is something really very important. Why? I have seen, guys, but believe me, that's true. Up to 70% of the champions cannot pass the exam because family issues. 70%. One reason out of 7 people or 10 people out of 10, like if you have 10 people couldn't pass the exam, 7 people they had one of family issue that didn't help them to pass the exam. For example, they have fights with their partners every day. Sorry, guys, I'm saying the truth. Or they have one of the family member that are sick and they look after it. Or they have kids, like toddlers, and they need to look after these toddlers. And then they may have family to work for. I consider this as family issues. Before you decide to take the exam, please, for me, guys, try to sort out these issues because they really affect your preparation and your result indirectly. You may feel it's just small things, but they are not small things. A question here for the new candidates. We may have some candidates here. They ask, should I take course or not? The question is, sorry, the answer is it's up to you. If you're asking me my opinion, I would say yes. We should take course because I have found that the people make it short and easy. I have found that the candidate take courses, they have a higher chance to pass the exam than the candidate do not take courses. However, I have seen few candidates they can pass without courses too. Again, guys, be aware about when you take course because there are some people they just copy and they're not real and then they haven't even passed the exam. So if you want to take course, ensure you take course from someone who has passed the exam, someone have good experience, because if it's just about some articles here and there, any one of you, I can give you one link. It has all the articles. Or actually easy thing, just only go to ADA website and then you will search. Even you can get registration with ADA as a student and then you can download most of these articles. However, this is not everything to pass the exam. So if you think the exam is about some ADA guidelines and then you're going to read them and then that's going to make you pass the exam, I'm telling you, this is not right. Anyone can do this. Criteria and factors of selection of the right course. One, the right course should be dynamic course. What does it mean? It means the course can be updated. And this is what the candidates really love about our courses. I'm not saying this because look, by the way, guys, we are the best people giving courses, and this is can be easily showing, not even showing, that can be easily told to everyone based on many reasons. One, the experience, and no one can say they have better experience than me in this with ADC. And then as teaching, two, no one has my experience being working here in South Australia between the patients and between the specialist and the guidelines. Three, no one spend the time like me, either in part one or part two for ADC, with all knowledge between part one, part two. I'm the only one who successfully teaches for both, with the highest success rate in both. And when I say the high success rate, not coming from names or numbers, it does come from experience. You can check this from the candidate they passed. And then our candidates in part two in academies, that's make everyone else crazy. How we can have all these candidates, either in part one or part two. So definitely, guys, with all confidence, no one can claim this except us. No one has an academy in Sydney and Melbourne. They started there. No one can tell you this. Everyone say this, say no. Dr. Bidu said something differently than you. Let's check the Facebook and see who has started all this, and then you will know who has the best numbers and the candidates reviews. Either in our videos, guys, you can see them, they talk about us, how they talk about us, because I believe in you and they believe in us, and then the leaders. And then everyone, I would say, most of the people, they copy us. You can say this from the way they teach right now. So again, things to do, you must ensure that you got taught by someone who has passed the EDC. By the way, ask the tutor, did you pass EDC? Did you pass part two? Part two, not part one. Don't be shy. Don't be shy or feeling bad to ask. By myself, guys, yes, I passed my part one for first attempt, part of first attempt. I'm working in Australia since long time. Right? This is my statements to you. So things to do before you choose any course. The success rate, as I told you before, since since 2011, the time I start teach, until now, we are the highest without stop. Without stop means really without stop. We never stopped at any time. We always the highest. Check this from the Facebook and other stuff. Compare, right? Either part one, part two. Knowledge. I claim I have the best knowledge based on my experiences. In part one, part two, because you may teach only part one, but you're not aware about part two. Part two is actually, part one now is part two, by the way, guys. Make it easy to you. Part one is part two. The question you get in the exam, it's part two questions, but in written format. Just make it easy for you. How to do a cavity prep. I discussed this before. I believe that is a question easy in exam. CPR, again, it's part two. Easily part one exam. Extraction, it's a part two. Easy part one exam. Cases as RCT, perio, all the stuff. Issues with your colleagues. All these topics is part two. Fluoride, caries, it's part two. Now, It's a part of part one as well, exam. Okay, guys, so things you need to do to choose the course, things to avoid. If people, they really, I would say, they didn't pass the exam. If they don't really work in Australia as dentists, they are maybe overseas somewhere. They don't understand what's happening here about laws and regulations. They don't have that much experiences after they pass in the exam. By the way, courses, as I said, should be dynamics. What does it mean, dynamics? It can be easily updated in between. And this is the good things about our courses. It's easy to be the way I learned from, because in the beginning I used to have only one format for one course and I keep repeating it from time to time. But I found this is not going to do any good changes in the courses and the candidate will feel overwhelmed. Look, guys, every option in this life has its own benefit and risks. Some people say, okay, I need only one course from the beginning to the end without any changes in it. I'm saying that is easy for me to do it, but not good for you. So the risk is, the good thing is you will be knowing what's happening from the beginning to the end. But the risk is it's easy for me, it's a benefit as well. But the risk is you will not learn something new and they're going to put you under too much pressure. Because when you look at the course from the beginning to the end, you will know what exactly you need to do in every single step. You may say, oh my God, when you look at this all study materials in one go, how come I will finish all the study materials in one go, even if you have study plans, daily based study plans? But for me, I rely on dynamics type of course, which is I give you the course, it's already made, like I already have it with me. I already have this, all the courses was everything in it, but I always keep some gaps in between for any update should be happening. And even before I give you any step, I look at it again and see, okay, in these steps, I need to do something new this time. So the good thing is my course is dynamics. I give you in steps, like the first step was warming up stage, and we're going to discuss in this. I believe the course itself on Monday, on today is what? Today is Wednesday. I think it should be somehow on Friday. We're going to discuss about the course orientation itself on Friday. So on Friday, we're going to discuss about the course orientation itself. So that's, guys, what I'm saying. Actually, I may swap right now. Guys, what do you like? Do you like the course orientation to be on Friday or Saturday? You see, that is what I like about us because I give you space to choose with me. Or would you like to be the way around? Because we decide to make the new TG task on Saturday, so we can swap. I will even give you a poll. We make a poll about this, and you can choose which day you like to be in either or both. Now, things to avoid. I said in the beginning, that's if the course is just start from, it will be with the same contents mostly, or maybe to give you all the materials in one go, not in stages. That's gonna make terrify you. Social media and study group impact. It's important, but ensure that when you are in any social media or study group, in a study group, it's a real one. And then the people they run it or they provide you the answer because not every answer is correct. Right? It should be the right answers and run by people. They have passed part two and they work in Australia. Don't be shy to ask the tutor, did you pass part two? Are you registered dentist in Australia? Time period required for preparation. I always recommend 3 to 4 months as the best. Most common questions asked by the candidates: how long should my preparation be set for part 1 examination? As I mentioned, 3 to 4 months will be good. However, I have seen people they passed after 4 weeks of preparation, believe me. How many days a week? Every day. Yes, every day. Again, guys, my answer, it depends on average and experience. What does it mean, average and experience? We are different. Some of us are very smart, very smart. They can read very quickly. And some of us, they can stay 12 hours reading without feeling bored. And by the way, I am from these people. I can read for 16 hours. I don't mind. I can work for 16, 18 hours, sometimes even 24 hours without stop. I don't mind it. Some of us, they have these personalities, some difference. Some they may say, I have family and then I cannot really read every day. But please, guys, even if you cannot read for hours every day, at least read 1 hour per day. Because if you're going to have some pauses in between, believe me, this break or this pauses in between will be longer. For example, if you said, okay, I'm not studying today, you know what's gonna happen? You will not study tomorrow. And they will not have, and then you will not study after tomorrow. And they will not study for the next 2 days, the next 3 days, and believe me, you will stop for a month to study. So my experience, based on my experience, I would say never skip any day, even in that day if you can. Open the book just to watch it. Just look at it, watch it. You don't need to study that hard. Much better than if you don't open the book at all. How many hours per day? As I mentioned in the past, we used to ask the candidates to study 10 hours per day, but now with the cakes and video bites and the notes, we made it easy for you. I believe 3 to 4 hours will be enough. Your study plans should be divided in 2 phases. The first phase, we call it as subject study, subject-wise study. Phase, study phase. That's what we do right now. That's why we give you the warming up stage. It's some sort of study. And then we start the main course with all subjects, all the topics, and even the new topics and everything, the new questions, the new topics, everything will be updated in the main course stage. And this is what will start at this Monday. Then revision stage. You know, we have done TG the last few weeks. We're going to revise TG again. We're gonna revise it in the main study stage, and then we're gonna revise it again in second, and then in the second TG phase, and then we're gonna revise it for the third time in the revision stage itself or revision phase. And then whatever study materials we went through in the main course will be revised, and then will be revised again before the exam 1 or 2 more times in the smartest. Look, every time we give name to the stage, but we have up to 7 stages or 8 stages. Last time was 7 stages. This time I believe it's gonna be 8 stages, and then these stages will be more towards study and revision. Study, revision, 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 revision. That's the way. Study, study, revision, study, revision, and then revision, revision, revision. And we revise everything multiple times with the new questions, new topics, new mocks. My expectation as well. Selection of study materials. This is my job. I will be giving you this. It's easy thing. This is the easy thing ever to select. You know what, for example, when I came home today from the airport, the first things I looked at is my mailbox. Because in my mailbox, I have I get lots. I got the ADA updates. They send me the updates, and then I open ADA updates in mailbox because they send it to me my home or my clinics. So before even I sleep, I was very tired. For even I sleep, I just opened the ADA updates, and then I found all the topics. I can even take a picture of this and show it to you. And then all the topics that says an interest in Australia these days. And these topics, believe me, some of them they came in the last exam, and I believe some of them will come in the next exam, in this exam too. So don't worry about the selection of study materials. We're gonna discuss these topics. How to study? Again, we'll give you daily study plans. You need to follow this. How to go through the study materials? We make lecture for you to go through this. Guys, I believe, as I said, this is gonna be only 1 hour. It's no more than 1 hour. But there are time. This is the time now. If you want to ask questions, you are very welcome, guys, to ask questions. I'm very happy to answer your questions. And by the way, while you are thinking about questions, I will be getting now the questions on the Facebook that you want me to discuss with you. Give me 1 second, please, guys. Let me just go in the Facebook here right now. Please, guys, if you can tag me into the questions that want me to revise, or sorry, the question you want me to answer, please, guys, tag me them on these questions, please, guys, so I can see them. I'm waiting for you guys to tag me on these questions, please. The important questions you want me to answer them. Please, guys, once you tag me, let me know. Thank you. Guys, did you tag me? Okay, let me share the screen right now. I think something happening here. I can see some questions. Guys, can I see my questions right now? Sorry, guys, I don't have the Let me check your answer. Sorry, guys. Maybe you have asked me some question. Let me just check your questions first. If you have any question to ask, sorry, guys, and let me do this one first, and then we jump into the Facebook questions. Thanks. You guys, I'm looking at the Facebook chat right now. If you have any questions to ask, give me guys 1 second. Okay, there's a question here, Doctor. On Friday, there will be a new study plan, or will be on Monday? Will be on Monday, Dr. Fatima. Dr. Simran says, okay, let me just get it from here then. Let me get it from this. I don't know why I cannot see. Look, guys, this is a problem when I Facebook right now, it doesn't actually show me all the comments. It does only show me this. Let me just check from here to there. No, there's no comments. Even if I click here, it doesn't make any give me any comments here. Live chat. It doesn't give any comments here as well. Doesn't show me any even here. There's no comments. Anyway, it could be just a glitch. Because now I'll be able to see all the comments. Anyway, a question here. So from Monday, we are going to start a new, yes. From Monday, we're going to start to go through every single subject, Dr. Koshikan. From Monday, we're going to start to go through every single subject. Yes, you're right. The second with the subjects there. Yes, that's the one. A question here. Can I get the contact number of the team? Please, team, can you please answer Dr. Fatima, the person, please? Can please comment there. What is the answer to question 2, doctor? Which question? Sorry, I cannot see it as I see right now. Can I have it here somewhere? Don't think so. I think it's a glitch. No problem, Dr. Koshikan. Pregnant question, A list, and the safest time to do elective treatment. Dr. Harisha will be okay. The A list is to do at any time during the pregnancy, no problem. But the safest time is after delivery. That's the safest. But the A list is at any time during the pregnancy. But the safest is after. There are lots of questions and then I cannot see them. Eesh. Wow, the questions, too many questions, and then I cannot see all of them again. Dr. Alifea, can we get the study plans for the next week? Will be uploaded from Monday, doctor. Monday, yes. Because we're going to start on Monday. Doctor, it is in photos. Can you go through the questions, please? The question there. Which photos, doctor? Some of these photos, maybe this one? This is on the page, right? Okay. That is a very good question. How to manage a study with a newborn? I am lacking in the lots of tasks. Doctor say that this is really very good question. I'm giving an experience of one of our tutor, but I will not mention her name. She used to tell me all the time. She used to tell me all the time that for the newborn, she found three ways, and they've been the best three ways. One is to study at the time when they sleep. When they sleep, once a newborn is asleep, then to start study. Two, to get her partner to help, because she said the same things. She said, I got my partner to help me. Can take the newborn for some times, and then I start studying. And then the third is to get someone from the family member to help as well in this. Apart from this, she used to study in between with a newborn, but I know it's really hard because they keep crying a lot, and then they've been very demanding. Okay, I believe that's a question you're asking for, doctor, when you said there's a photo. Question of the day: patient has some changes on the tongue. You diagnosed with glossitis. Glossitis means there's inflammation on the tongue. Which vitamin deficiency does the patient have? We may expect vitamins will be vitamin B12, B Bravo. I see most of you guys, you answered the right one. Yes, B Bravo, you're right. Let me get the group itself. Give me 1 second, please, guys. Just over to this one. Then go back to see your comments. Home. Okay, there is a question here. Dr. Fatima, wherever you comment, guys, I actually click on it so I can see your question. Okay, guys, let me share this now. Guys, can you see my screen right now with this question? Guys, can you see this question right now? Please, Dr. Fatima, if you can comment again, because I see you have commented on why it's coming differently now. Yeah, I can see your comments here. Yes, okay, that's fine. So the question is, a 25-year-old patient complains of sensitivity to cold, which is lasting for a couple of seconds. When I say the word lasting for a couple of seconds means we're talking about reversible pulpitis, not irreversible, reversible. Given the attached photograph and the information provided, what is the most appropriate diagnosis for tooth number 16? Look at here right now. Guys, as I see this, do you think which one of this I see this? By the way, guys, I see this is one of the topic that's ADC, that's TG actually has uploaded or actually updated or upgraded recently, and we really need to go through it. I see this. So now, given the touch photograph and information provided, what is the most appropriate diagnosis for tooth number 16? Is it deep fissure with reverse pulpitis? We mentioned this. We mentioned it is reverse pulpitis. So how did I know it is reverse pulpitis? We know it from here, from this word. Couple of seconds. When you have sensitivity, couple of seconds means it's not normal. It is not normal, but it is, right? But it has reverse pulpitis. So option A can be correct because it has reverse pulpitis. Option B is incorrect because it does say healthy pulp. And then reverse pulpitis can be option C. Established decay with healthy pulp is wrong because we said it has reverse pulpitis. Extensive decay with reverse pulpitis. So now we are between, if you say deep fissure with reverse pulpitis, it's not deep fissure because this is open. The fissures are all open. And then I see some areas with changing color. So it's not deep fissures, it is decay. So now we are only between either C option or E option. Is it really extensive decay? Based on the photograph, no. I need to take an X-ray to confirm this. But based on the extensive, based on the photograph, it is established decay with reverse pulpitis. So the answer is C, Charlie. Okay. Let's see if there is any another comments. Please, guys, comments if you really want to. No, code 5 is active, Dr. Daniel. Code 5 is active. Okay, guys, give me 1 second, please. I see you have comments on one more question here. Okay, guys, can you see this question as well? Now, this question, given the attached radiograph, what treatment has already been completed on tooth number 64? So we're talking about tooth number 64. 64. Guys, that should be 84, okay? Here's this one. 8584, and that should be 46. Okay. So yeah, so we're talking about 64, sorry, 84. So this is 84, this 85, and then 46. Now, the question is, what guys, what do you think is the right answer? A, pulpectomy. Anyway, let's decide on we have two things right now. I need to look at the crown. Okay, we're looking at this tooth, by the way. We look at this tooth. Okay, which is 84. We're looking at the crown and the roots, the canals. So pulpectomy for the canals. When you have pulpectomy, you will use zinc side eugenol. How does it look like for pulpectomy? It look radio opaque. So in this case, I should have seen, instead of these black canals, I should have seen white radio opaque filling inside. So guys, do you see any radio opaque zinc soluble filling inside for pulpectomy? No. So any option for pulpectomy should go away, right? We should discard it. So discard this one. Discard this one. And dipulp cap and stainless steel. Okay, so option A and B incorrect. Forget about them. Now, inside the canals, we excluded two options based on the canals. Let's now look at the crowns. The radio opacities of the crown. Well, let me know which type of crown it is. If it is really very radio opaque, like very white, like this radio opacities, we're now talking about strip crown, composite crown. But if it is radio opaque with like radio opaque periphery, because the cement, and then the rest is a mix of radio opacity and radiolucency, like a little bit of black areas like this, that means still steel crown. If it's completely radio opaque, like this area, or this part, which is filling part, means it's a composite step crown. But if it is black like this, a shadow of black and some white areas on around the peripheries, which is a cement mostly, right now it is still a steel crown. What do you think it is? Is it still a steel crown or composite crown? Do you think the radio opacities of the old crown like this radio opaque, or it's a mix of radiolucence and radio opacity, the crown itself? I think it's a mix, right? That's why it's not a step crown. It's not a strip crown, which is composite. This one's gone as well. So this one is gone. Sorry. This wrong. This wrong for the canal. This wrong for the canal. Now the only two options left for us is C, pulpotomy with stellate crown, or E, indite pulp capping. Indite pulp capping, you will find the filling will only stop before the canals, only at this level, because indite pulp capping, the pulp should be until this level. And then you will find the restriction only stops here at this level or maybe at this level, but not inside the canals. But you see the restriction is inside the canals. Even this one, the restriction is canal. So in this case, it's pulpotomy, means you put the medicine inside the pulp chamber, but not
Inside the canals, not away from the canal. So the answer is C, Charlie. Answer is C, Charlie. Pulpotomy was still a sacrum. Let's see more questions. Okay, guys, there's another question here, and this question about Dr. Shiva asked question on the comments itself. Dr. Shiva says, Dr. Bedo, in a 70-year-old patient, what is the key difference between chronic gingivitis and active periodontitis? It's a true pocket depth, doctor, true pocket depth, because swelling gums can happen, attachment loss can happen at any age, bone loss can happen, but true pocket is the key words, okay? Now, for this question here, a 60-year-old patient of complaint difficult of speech, okay, 18 and she feels her mouth dry, okay, has kept sipping water. So now we're talking about dry mouth. GP reduced the circulation finger, has used artificial teeth, okay, the bad. What is not true regarding Sjogren syndrome? Something not true in Sjogren syndrome. Guys, what is no problem, Dr. Shiva at all. Guys, what do you think is not true about this Sjogren syndrome? Most common cause of dry mouth. It can be fine. Mainly affect males. Can cause dryness? Yes, can cause dryness. Can show cognitive disorder? Yes, cognitive disorders normally happen with females more than males. So, guys, what do you think the answer for the first question? A, B, or C, or D? Again, main cause, most common cause, yes, it's very common cause. Or actually one of the most common cause of dry mouth, correct. B, I believe it happens in females more than males because connective tissues, guys, take it as this way. Remember this way. Connective tissues disorders happen with women more than men. So the answer, guys, is B, bravo. This. What is the most important investigation would you do? Our issue right now is Sjogren syndrome. And then looking for, and this is very tricky question, by the way, very tricky question. Guys, when we do investigations, what is the first, most important investigation toward what? Toward treatment, sorry, toward the cause or toward treatment? Which one is more important, the cause or the treatment? When you do investigation, which one is the most important when you do investigations? Is toward what? Cause the investigation will do toward the cause or toward the treatment. Guys, I need you guys to be quick when you answer. Because in exam you have no time. In exam, You have only 1 minute max for every question to answer. So be quick. Thank you, Dr. Fatima. You mentioned codes. I love this. Now, looking at the question, it doesn't say anything about the current condition, right? The question itself, it doesn't say 6-year-old complete difficulty speech, eating she feels mouth is always dry. So now what I know about the condition, about diagnosis, dry mouth. But do you know what is the cause of dry mouth? The cause, right? What is the cause of dry mouth? So now, which one is more important? Now, it's mentioned the patient has already dry mouth. She feels dry mouth, right? If you say salivary flow rate, I will be happy. If you mention calogram, I will be happy. B and D clinically correct. Identify the cause. B and D, both of them correct. And this is a trick in EDC exams. Most of you guys gone with B Bravo, and I agree this. I definitely agree on this. B Bravo is correct. Do you think D correct or not? You see, everyone goes with B Bravo, and this is what's happening in exam. The concepts, guys. When you know the right concepts, you see the concepts in here. I tell you the concepts in order, one by one, in order. One, patients complain difficult speech, feels her mouth always dry. When the patient comes with dry mouth, the condition is diagnosis dry mouth. Means I expect the salivary flow rate will be low. I expect it. Now, the question asks about what is the most important investigations. Investigations here can be two things. One investigation to treat the condition because I know it's a dry mouth and most probably salivary flow rate, most probably, mostly, not always, but salivary flow rate can be low. And two is to identify the cause. Why she's feeling this. So which one is most important here? Is to she's already told me she has dry mouth, the patient herself. So which one now it can be more important? To know about the salivary flow rate and she mentioned it is low, or at least she has dry mouth, or cielogram to check what can be the reason behind this. Is it stone down there? Is it something happened to the canal itself? Something happened to the gland itself? So which guys, one of these two options, B and D, direct toward the reason as most important. Yes, both of them important. I agree. Salivary flow rate is important. And cielogram is important. One is for the cause, to identify the cause, why it's happening. And the other one to see how severe is the condition. So which one, guys, is more important to identify the cause? Cielogram or salivary flow rate? Definitely, guys, cielogram for the cause. Okay? Both of them correct. Salivary flow rate is correct. Cielogram is correct, but cielogram is important because actually this toward the cause. Especially the patient has dry mouth already. Question 3. How will you initially manage this patient? Are you going to provide any antibiotics? No, really. It's not an infection case. No antibiotics. Symptomatic treatment? Yes. means any pain or any discomfort, we really need to provide symptomatic treatment. The rest, it doesn't make any sense. So, guys, the answer for question one is B, bravo. The answer for question two is D, delta. However, B is still important, cellular flow rate, but as most important investigation is C, is D, the cellogram to identify the cause. And then question three, guys, please, guys, that's a key word we mentioned. That's a key word, and these concepts and critical thinking we really need to do. How do you initially manage this patient? Symptomatic treatment, relief treatment, give him relief, relieve the condition. Okay. Another question here as well. Guys, when you comment, I can see the question, okay? Guys, I hope you see this question too. Given the attached photograph, what could be the diagnosis of this appearance? Is it abrasion, erosion, atresia, paroxysmal fracture? Look, there is no any risk factor has been mentioned here at all. There hasn't been mentioned. Is it chemical used? Is it paroxysm? Is it toothbrush? It doesn't mention in the question itself what is the reason, only based on the appearance. This condition, it happens because of two things. Right? This condition, most probably, it has happened because, or actually, diagnosis of this appearance. It has happened because of erosion or atresia. Erosion or atresia, or both together. If I have an option has both together at erosion and atresia, I will love it because that's the best. But based on the photograph only, based on the photograph, the answer is atresia. Why? Because if you look at the teeth to each other's, they are actually surface to surface. Yes, it has some of erosion signs in there, but as if the clamping, when you have you put hand on hand, I don't know how I can get this one, maybe it's something here, like hand on hand, like this one, like this one, this one. You see? I will post it. This. When you see the teeth, the upper teeth and lower teeth, they are having this shape. Most probably now you're talking about atresia rather than erosion. However, erosion is still there, both of them, but depends on the photo only. Atresia is more evidence. But again, you need to get proper history to tell. Only based on the photo, because you may get this photo and then being attached as erosion, as if diagnosed as erosion. But when you look at the whole case, you'll find the case itself mentioned the patient is on acidic food, for example. Another question? Hmm. So now I have a cause here. I have that now two things, the appearance of the teeth and the cause. The cause is asthma and patient taking puffs, which is acidic. The the puffs guy is acidic. So now we're looking for erosion. Yes, also into sports and vegetarians, very much in sports. Most probably because people in sport drinks. What could be the cause of this condition? The cause. They ask about the cause. I see most of you going with D, D, and A. D, 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 D. E, D. Okay. Let's agree this is erosion case. But the question doesn't ask about erosion. The question asks about what's the cause? What could be the cause of his teeth? The cause. So cause, it's a part of the pathophysiology. The pathophysiology. The appearance is erosion. The condition is erosion, but the cause of this condition is different. Okay, guys, so if the question please guys, be careful about the keywords in the exam. That's what I'm saying. That I'm saying, please guys, we need really to think rather than to quickly answer. What could be the cause? I mean, like think and quickly answer both together because you need to be quick when you answer, by the way. Now, what could be the cause of this condition of the teeth? We're not asking here about what is the condition. We ask about what's the cause. So A option can be correct if they ask about condition, but they don't ask about condition. So now A is not correct. We ask about cause. Sport drinks. Where about the sport drinks has been mentioned here? Guys, where about? Mention the patient on sport drinks. Guys, has it mentioned anywhere the patient on sport drinks? Who says this is sport drinks only? Even sport drinks when happens, it happens more from palatal side, not from the buccal sides. Mostly palatal, not buccal, not labial. So the appearance of the teeth doesn't look like sport drinks. And also nothing has mentioned in the scenario the patient use sport drinks. He does sports, but doesn't mean every single person who does sports in sport drinks. It doesn't mean this. Right? He plays sports, but it doesn't mean that every single person plays sports and sport drinks. So definitely B Bravo is wrong. C is gone. C is anything. The only thing left for us now is asthma puff. Why? Because this question tells you, please, when the patient takes an asthma puff, they should use a spacer. We need a spacer to go into his throat or his lung directly Not because sometimes when they puff, they actually give the puff on the front teeth, as you see right now, on the facial surfaces of the front teeth, rather than to use a spacer. Okay. So answer in this case is the delta. Again, guys, please be careful because exam questions will be something similar to this. Okay, there's another question here. Dr. Alifea commented on it. So I have seen it right now. The question is about this photo. Wow, it's a big, 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 big gingiva. Um, gingival enlargement. Ooh. Now, which medication that most likely cause this condition? Definitely, guys, A alpha, phenytoin. What other risk factors may accelerate the condition? Guys, are you aware we have sessions on Friday and Saturday? You aware about this? And by the way, guys, I'm back again. So I believe I'm much better than before. So we will start from today and then Friday, Saturday, and then the course start on Monday. So guys, I need every one of you pay attention back again. Okay, guys? So option is A, alpha, phenytoin. Hopefully, guys, I'm not getting sick again. I don't know why I'm getting sick these days. What other risk factor may accelerate the condition? Definitely plaque. Plaque is a devil. Put this in your mind, your head. Plaque is a devil. What does it mean? When you have a plaque there, it causes irritation. The irritation definitely will result in this stuff. Malocclusion. If you clean the teeth with malocclusion, nothing will happen. You need plaque. Malocclusion without plaque is nothing, but malocclusion with plaque is really something. What is your initial management? Scale and clean. Refer to specialist. C. Charlie, give anti-inflammatory medications. Doesn't really make any sense. Gingivectomy doesn't make that much sense. As initial management for today, scale and clean. A. Then after you do scale and clean, you refer to specialist. So A and then B Bravo. Okay, guys, I believe we have done for today. We'll be seeing you on Friday and Saturday. One will be for the new TG topics, exam topics, and the other day will be for, and the mock exam, I believe, will be on Sunday as well. By the way, guys, we follow right now a new strategy because we need to focus only on the candidate they really pay attention. That's why when we do a new sessions, we give a new link. So if you see a post that we ask you to comment in it, please guys comment, especially for extra sessions, because whatever is the academy sessions on Monday and Wednesdays, which will start from this Monday, we will use only the only private link, Zoom link. Otherwise, if you do any extra sessions, guys, and then interested to join it, you please comment on the post because I'm gonna post right now. If you don't comment on it, it means you will not get the link. Okay, guys, I was very tired today, being just arrived to the land and also being sick, but I was happy being between you guys. We'll start again from this Friday and Saturday. Was all power, all energy back again. Please, guys, let's start. Give your 100% concentration focus right now. Thank you very much, guys. See you then on Friday and Saturday, and then the course will start on Monday, and then on Sunday will be the mock exam. Thank you very much, guys. Have a great night, every one of you. Was happy, guys, having you all of you. Thank you very much, guys. Bye bye. That is great. And look, first, I'm very proud of you. I'm very happy that you passed. I told you this from the beginning. You're going to pass. It was just only an attempt. And I believe in you. You're going to pass. I'm very happy now. You told me about this. I'm very happy and very proud of you.
Thank you. Thank you, doctor.
Thank you very much. You did me know. That's what I expected. That's it.
Yes, yes, doctor. I just want to clear my second part two exam in one go as well. So yeah, I need your help for that.
Yes, definitely. I will be helping you. And then at any time, if you need my help, I will be next to you. definitely.
Sure, sure. Yes, because currently I'm studying for my master's as well, which will be completed by the end of this year. So I'm hoping I need a like a strategic plan how to proceed next. So
Yeah. So that's okay. I will be in Most Open Academy next week.
yes,
So I just arrived just today. So I will was prepared next week, and then definitely the academy. I've seen you many times there, and
yes,
we
yes.
did the right time. So you are in Sydney this time, right? Or, okay,
To be close to the academy, so it's
I know.
just a 10 minutes drive home.
Okay, that's good then. So
Yeah.
yeah, that's great. Then so I will meet you in the academy then, and we discuss all the steps for part two as well.
Sure, doctor. I'll text you next week, and then we can arrange a time which is suitable for you.
Thank you very much for this. Yes, I'm very proud of you. I'm very happy. I told you.
Thanks.
I told you were past. I just thought it was like a.
Yes, doctor. For a couple of times, it was just one cluster, but now I hear it. So yeah.
I'm sure it will be great in part two. I'm sure. It will be
Yes,
great in part two.
yes, doctor. Absolutely, yes, doctor. Thank you.
Thank you very much, sir. That's what I said. I'm very proud of you.
Thank you.
Very
Yes,
happy.
doctor.
And thank you very much for letting me know. Thank you.
Yes, doctor.
Thank you very much.
Thank you. Thank you.
Hi, Dr. How are you going? Hi, Dr. How are you going? Thanks so much for texting me, and congratulations for passing part one. And definitely, it's my pleasure to have you part two as well. So I just saw your message right now, Doctor, because I just arrived today, and I will be sending you the details right now to contact the academy. And if you need my help at any time, I will be very happy to help you. Thank you very much again. Thank you. I will send you the details. Thank you. Hi, Dr. Zeb. Just contact the academy on the link I give you right now. Then I will update that to help you too. And still, if you didn't help from my side, please, thank you very much.
Hello guys, can you please look after this candidate? He's texting me personally. Please look after him. And then try to make things easy and simple for him. Please cut as much as you can. Hi, mechanic, how are you going? Sorry, sorry for the mechanic. Yes, please. There are some test replies. I will be uploaded to you shortly. Sorry, it will be uploaded Monday. Sorry for this. So you can revise it, please. Yes, and we're gonna go through every single subject, so we can go through all the study materials related to every single subject. You're right, Doctor. Thanks. Thank you, Doctor.
You know, we are doing better now, especially now right now because I just checked and and I don't see any technical package you order, and I'm trying to get everything separately. But I want to get everything from one dental, so everything is pretty similar to ADC. I'm also looking on dental market. Dental market does have the package, and there seems to be some sale going on. And yeah, it's really confusing. Please give me a call or maybe coordinate me with someone from the Melbourne Academy so that I can figure out what to order and place the order as soon as possible. And thank you so much for helping out with all the sessions. Everything is really helpful and I'm making notes. Please let me know if I can do something to prepare better for the technical course next month. Yeah, I really want to start preparing. Like it's been so hectic with the nursing job altogether, but um, I am trying to invest more time for the exam, specifically starting this week. Thank you, Dr. Bidor. Talk to you soon. Whenever it's convenient, please give me a call. You have my number. I have texted you over the number as well. Thank you. Bye bye.
Hi, Dr. Santry, how are you going? Thanks very much for texting me. And yes, the fact I went through your message, and thanks very much for wishing me good health. That means really a lot for me. Thanks very much for saying this. Please don't stress yourself out because I know now your concern, which is buying things from one place only. Look, that is okay. So what we can do is whatever available, you can buy it from them. Otherwise, we need to find substitutions. If you have a doubt about anything you need to buy, something really we not sure about it, or you think it's not good quality thing, just discuss with me and then I will be helping you. Right. And yes, I'm going on with my sessions all the time and then we'll be there. And Dr. Ann now teaching even for Oski. So part two now will be even, I would say, much more interesting, as well with lots of information and knowledge. And that will be great as well. So please don't be under stress. If you won't take my opinion about anything, please let me know and then I will guide you. But again, don't just wait for any materials. Whatever available, just buy it as long as it can be somehow a help in this situation or at this stage right now. And I know it should be hard on you because you work as a nurse at this stage. I understand this, but I'm sure you're strong enough to go through it. If you need my help at any time, please let me know. Thank you very much. Then I will be next to you and around you. Thank you very much, Sanctuary, for this. I really appreciate it. Thank you. Guys, can you hear me?